Hi, my name is Jessica Carberry. I'm going to be doing an assessment on Kyle here on his head, neck, and his eyes.
Hi, I'm Kyle. I give consent for this stuff.
All right. Such a willing participant. All right, so I'm going to start with your head. So first I'm just going to ask you a couple questions. Just answer them the best you can. Have you had any increase in the amount or severity of headaches?
No.
Are you experiencing any dizziness?
No.
Okay. Any of you had any history of head trauma?
No.
All right. So I always start out with inspection of the face. So I'm going to look at the face. I notice that it's symmetrical. There's no drooping. There's no involuntary movements or swelling of the face, which is good. And then now I'm going to just palpate your skull, okay? So I'm going to start in the front here. I'm going to move all the way down. All right. I don't feel any abnormal protrusions or anything. Do you have any tenderness with that?
No.
Okay, good. All right, and now I'm just going to feel for your temporal pulse here from the temporal artery. Good. All right, I'm going to move down to the temporal mandibular joint. I'm going to ask you to open and close your mouth. One more time. All right, and that's smooth with the movement. There's no crepitus or pain with that?
No.
Okay. All right. So now we're going to move on to your neck. All right. Are you having any neck pain?
No.
Any stiffness?
No.
Okay. Are you having any lumps or swelling?
No.
Do you have any history of swallowing issues or difficulty with eating?
No.
That's great. So cheery. Also, one thing I wanted to add is I noticed your expression was appropriate for the present time. Like not excessively aggressive or angry or anything like that. So do you have a history of head or neck surgery or injury?
No.
Okay. All right. So I'm just gonna look at your neck. If you just lift your head up a little bit for me, thanks. I noticed that the trachea is midline and it's symmetrical. There's no swelling. I don't see any lymph nodes. I can't see the thyroid gland, which would be right around the center here. And I don't see any visible pulsations of the carotid arteries, which is good and normal. So what I'm going to check next, also too, I just wanted to add is your head is sitting midline on your neck and you're not struggling to hold your head up, which is a good thing. So now I'm just going to check your range of motion with your neck muscles. So I'm going to ask you to move your head, okay? First, just do your chin to your chest for me. Okay? And then to the left and to the right. Okay? And then I'm going to have you do your ear to each shoulder without raising your shoulders, okay? So just as far as you can go. You don't have to, like, push it. Oh, you had a crack there. And then extend your head back for me. You having any pain with those movements?
No.
All right, good. So I noticed that the movements are smooth. The patient hasn't experienced any pain with those movements, which is normal. So now I'm just going to check to see if your cranial nerve 11 is intact. So I'm going to ask you to meet my resistance with my hands on your shoulders. So just shrug up for me. Do a shoulder shrug. Good. And then against your face. So I'm going to have you turn and like just meet my resistance. Good. And good. Okay. All right, so now I'm also going to palpate the trachea, so just lift your chin back for me. I'm going to find the sternal notch, and I'm just going to go from side to side, and that's midline. From there, you can return your head back. I'm going to palpate your lymph nodes. If you have any tenderness, let me know, but I'm just going to press gently. You have any pain? No pain?
No.
Okay. All right, and then I'm going to palpate for the supraclavicular nodes. Good here, and then just bring your head like this for me, and I'm going to palpate the deep chain nodes. Good. Which are along a little deeper in the muscle, so you kind of have to change your technique. All right, good. Okay. Now I'm going to attempt, the last thing I'm going to do for your neck is I'm going to attempt to palpate your thyroid gland. Normally this, I can't feel this. If I were to feel this, that means it would most likely be enlarged. But if I do feel it, then I will listen with my stethoscope to see if there's a bruit, which is just like a whooshing sound. So I'm going to stand behind you for this. And I'm just going to, if you want to face the camera, just so they can see. So I'm just going to find the sternal notch here. I'm going to ask you to lean your head a little forward for me and to the right. And then I'm just going to push gently to the right. I'm going to ask you to swallow. Okay, now I'm going to push gently to the left and swallow again. Okay, and I don't feel anything, which is normal. All right, so now we're going to go to the eyes. So are you having any, time for some more questions? Are you having any difficulty seeing or blurriness?
No.
All right, good. Do you wear glasses or contact lenses?
No.
All right. Any excessive wateriness or excessive tears?
No.
Any redness, swelling, crusting?
No.
Okay. Any family history of glaucoma?
No.
Or have you ever been tested?
No.
Okay. And do you have any history of eye surgery, trauma, or allergies?
No.
Great. So when was your last vision test?
10 years ago.
10 years ago. Okay. So I would definitely recommend for you to get another one. I do not have a Snellen chart, so I'm not able to do that, but I am going to check your eye movements and your pupils and make sure everything is just doing what it's supposed to do. So I'm going to start off by inspecting as always. I noticed when you came in here, your expression was very relaxed. You didn't seem like you were struggling to navigate throughout your environment, which is sometimes or usually when people have difficulty seeing, they could have a confused, angry, worried expression, very calm. So that suits that aspect. I'm also just going to look, your eyes lay symmetrically on your face. You have the eyebrows are laying symmetrically on your face. You have lashes on both your upper and lower lids. And I'm just going to actually have you angle a little bit more so they can see what I'm doing. And then you have your eyes, there's no protruding or anything in the eyeball. Okay? I'm just going to look, I'm going to ask you to just look straight forward for me. I'm just going to look at your sclera, which are white. There's no yellowing, which could be indicative of jaundice. And your conjunctiva was pink, not dusty or pale, which could be indicative of like low oxygen centrally. So all normal. I'm just going to look at your lacrimal gland. Just good, there's no redness. Okay. Now I'm just going to check your 6 cardinal points of 6 cardinal positions of gaze. So it's just how your eye muscles are moving and working, okay? So turn a little bit more this way for me, just so they can see what I'm doing. I'm going to hold this out here, and I just want you to follow my pen, okay? All right, so we're going to go up, center, down, center, and go to the side. We're going to go up, center, down, center, here, and then we're going to go this way. All right, perfect. And your eyes were smooth in movement, which is normal. There was no nystagmus, which is a twitching of the eye. So now what I'm going to do is I'm going to hold my pen like really close to you, but I would like you to focus on the wall behind me. I'm just going to see if your pupils accommodate. So go ahead and focus on the wall, and now look at the pen. All right, and your eyeballs converged and your pupils constricted, which is normal. So next, I'm just going to shine a light midline to you. Your eyes feel a little goofy from the test?
Yeah.
All right. Sorry. I'm going to just shine a light in your eyes. I'm going to see that the light hits the pupil at the same spot, and this is just checking the corneal light reflex. So just look straight ahead for me, which they do. So the light appears in the pupils at the at the same spot. Now I'm just going to check your pupils, so I'm just going to have you look straight at me, okay?
Okay, officer.
All right. No, just look straight for me. You don't have to move. All right, good. So your pupils constrict, they're reacting to light. They're both round and they're about 4 millimeters in size, so they're equal. The last thing I'm going to check, I also noted that your cornea, there was no cloudiness, clear, which can be indicative of like glaucoma. So you're clear, which is great. I'm gonna check your peripheral visual field. So I'm gonna ask you to hold this and cover one eye. Good. All right. So just tell me when you can see my finger, okay?
Yep.
Good?
Yep.
Good. Cover the other eye for me. All right. And just look straight ahead and tell me when you can see.
Yep.
Good?
Yep.
All right. Good. Okay. So that concludes my assessment. Everything I found was within normal limits. Do you have any questions?
Nope.
All right. So thanks for watching.
Peace out.
Bye.